Hey everyone, welcome to the Psyched to Practice podcast, your one stop for practical and useful clinical information, masterful insight from experts in the field, and a guide to daily living. I'm your host, Dr. Ray Christner, and with me is
Paul Wagner.
And Paul, we kind of tackle maybe a hard topic professionally, and that is this idea of burnout in mental health professionals.
And certainly, I think we did a good job calling out in the beginning that the mental health profession, not the only one that experiences burnout, but, the one that we have our expertise in it, both, professionally, but also the experience of potential burnout of the symptoms and experiences there, and as well as how to help safeguard against that. And, I certainly hope that it's a thought-provoking, at the very least, a thought-provoking episode for our listeners, but maybe also an opportunity to pause and reflect and, just kind of giving some acknowledgement to just how challenging this field can be and, offering maybe some supportive changes that can have a really positive effect.
Yeah. And I think my kind of takeaway this episode was something you kind of said at the end, but you used the word bias. And, it was what I think kind of when you use that word, what kind of triggered for me is we are kind of biased in recognizing our need for help. We spend so much time, wanting to help patients, wanting to be there, wanting to, have ourselves available, that sometimes by wanting to help so much, we're blind to our own needs and we don't recognize them as well. And I think thinking of it as a bias and recognizing listen, we can have a skewed view of our own needs, I think is important to call out. And I don't think that's a bad thing. I just think it's something that we just need to be more aware and more thoughtful in kind of paying attention to. So how about for you?
I think the audience is probably going to get tired now, knowing what the episode entails, but I'm going to say it here at the top. Recognizing and being intentional. And, it's a word we use throughout, but just the significance of when we can be intentional in our actions to help create positive changes and supports for ourselves. It's a great way of building resilience against burnout or challenging burnout that's already here for us.
Yeah, I think that it's a word that we use often, but something that is, I just think, invaluable. And I'm curious for our audience, those of you that are listening, share kind of your thoughts. What are your takeaways? And maybe you have some tips or suggestions about managing burnout that we didn't cover, and we'd love to hear from you. So as always, join us on social media or feel free to send us a message and give us your thoughts.
And with that, we hope you enjoy this practice in action episode. Fizzle and Sizzle, bantering about burnout. Recording and good to go.
So, Paul, today we are going to maybe tackle a topic that is a little bit more serious and maybe even, I'd say, personal, given that we're in this field, and that is burnout amongst mental health professionals, and kind of what burnout is for people, and what do we do to prevent it?
Yeah, no, I think it's something that, especially in, I would say, more the education setting, I think it's touched on, but I don't think it's actually talked about. And really, especially coming out and into the field, I think it's something that can really catch clinicians by surprise, and certainly not even new clinicians, but even veteran clinicians. And honestly, maybe they're a bit more at risk because they've been, giving and giving, but eventually we do get burned out. Yeah. Yeah.
And I think that we, in the news, we hear about, all the mental health needs that are out there and, the mental health crisis that's existing. And, I think why this is so important right now is, we are in that, but we also, I think, as helping professionals, we're getting pulled more and more into, seeing more individuals and, dealing with wait lists and dealing with maybe, patients that we saw in the past that maybe took a break from therapy and now all of a sudden they might need to come back. And so I think, when we hear all these things about mental health crisis, we're thinking of it from a standpoint of clients or patients. And I don't think we do talk enough about the fact of how difficult it is for those in the field. And, we're going to focus on, mental health providers, but I think this extends to physicians and nurses and teachers. And, there's so many professions that I think, are dealing with this kind of idea of burnout, but maybe today we can hone in on mental health professionals. But I think this topic goes on to whatever, first responders, whoever we're talking about.
Absolutely. And, even as you're just describing that, it reminds me of something that it was probably, I don't know that I would call it a meme per se, but an image that I saw quite often in 2020 of, the artist rendition of the COVID-19, virus strain. And then it had a nurse, all dressed up with the N95s and full PPE, giving the finger to the virus. And then I believe it was like on the 1 year anniversary, or pretty close in 2021, we see that it's the same image of the virus, but now the nurse is just ragged. And we see then a nurse coming up behind them, pulling the first nurse and stepping in front. And, just like that, I think is such a powerful image. And that idea of, our healthcare system, the toll it took, and the call to action that came from professionals, and certainly mental health, I think, was a part of that. But, the influx in hospitalization. And I think we're now kind of getting the ripple effect of that, maybe a bit more so from COVID now, where, okay, maybe a bit more structure and support, but now we're seeing the aftershock, which I think is now certainly, I think, a part of this mental health crisis, many contributing factors. But, I wouldn't be surprised if I saw one of some famous therapist or psychologist given, COVID-19 the finger popping up sometimes, right, stepping in front of the nurse.
Yeah. I think this is, something where, over my career, I've seen other professionals. So, I've seen, I've had patients who were psychologists or counselors or physicians. And, I think what made me really want to do this topic is how many more I see now. And, it's where, there, people questioning, do I stay in my career because I'm just so overwhelmed? And, we're at, I think, a point that if we don't address this better, we're going to lose great professionals. Yeah. And so, not that in this, hour or so, 45 minutes that we're going to be talking, that we're going to solve all the crisis, but maybe to give some tips to people that at least will help them, maybe mitigate the impact that happens with the stressors we deal with. So, yeah. So maybe let's talk about when we say burnout, what are we really, what's that? What is that? What are we referring to? So, for me, I was trying to think what's the definition of it? And, so I kind of just threw together some words of, for me, it's this state of emotional, physical, and mental exhaustion. And that it's, caused, of course, by prolonged or excessive stress. And it occurs when we're really feeling overwhelmed or we're emotionally drained, and maybe getting to a point where we're unable to meet the demands that are placed in front of us. So that's, I think, kind of the general way I look at it. What thoughts do you have?
Yeah, I certainly think that's a really great wide net, but I think burnout can look so specific or, individualized. And, right. I think one of the most challenging things is that we almost don't recognize that burnout is approaching or that we are burnt out until we're actually there. And, whether it's, we have to soldier on or, it'll get better, whatever kind of thoughts that are there that are perpetuating and pushing us without creating and adapting some changes. And then all of a sudden we just kind of hit this wall and, our tank is out of fuel, and then we're kind of sputtering. We don't really know what to do. And so I think one thing about burnout that is valuable to call out is that oftentimes it's almost, unrecognized, and it's not unrecognized because the signs aren't there, but we're not necessarily stopping and really being intentional and taking in some of those signs.
Yeah. And I think, with those of us in mental health, it's interesting because, we advocate for the reduction of stigma with mental health. But in some ways for ourselves, we perpetuate that. And, we don't care for ourselves. I actually think those in helping professions maybe do the worst job at taking care of themselves and preventing burnout. And, and I think it's hard. Like, I think it's interesting. I think over time, I'm hearing more people who are letting themselves be vulnerable and say, man, I'm at a point where my stress levels are high and I need to make some adjustments. And not just feeling like we have to push through. And, again, and I think that's different for everyone. I mean, I think everybody's going to have their own way to deal with it. But starting with that recognition and not thinking we have to be strong because we're in the helping profession, that we are allowed to be vulnerable. We're allowed to be burnout. We're allowed to, give ourselves permission to feel the same feelings. These jobs are not easy. We hear a lot of things. I always tell people, no one comes to my office to tell me how great life is. It's a lot of throughout the day hearing struggles and processing. And while there's a great outcome to it, paying attention to how that takes a toll is, I think, important.
And we're talking about like this broader piece of it, but I think it would be helpful if maybe we start breaking down, like, yes, it's individual, but let's look at some of the more common ways that a burnout can present. So that way, if maybe, for our listeners, if they're like, oh, you start naming some of these, and like, hey, yeah, no, that does sound a bit more familiar. And honestly, if someone's in the mental health profession, I would be surprised if they don't at least experience this to some degree. But sure, our listeners that are especially maybe feeling like, oh, yeah, that's me day in and day out, or that's been me for the past few months. Like, maybe taking some time to stop and reflect, and we'll have some conversations further on in the episode. But I think just identifying some of those, maybe the more common symptoms of burnout.
Yeah. So where do we want to start?
Well, you brought it up earlier when we were getting ready, and I love the idea of, if we kind of start off with a physical, emotional, mental model, and then maybe even like broadening that out into some other broader aspects of ourselves. And so, maybe starting off with the physical. And I think even in your definition, one thing that's there is just that pervasive feeling of exhaustion, and whether we're getting adequate sleep, maybe we're overindulging in sleep. It's just that I'm feeling, just feeling a lack of energy. And I think I even borrowed this term, a few episodes ago, but just that a lack of zest as well. And so that there's just that feeling of like, I'm just kind of having to pull and carry myself through my day rather than rising to meet the day.
Yeah. And we talk about sleep a lot, and it's such an important piece. And, for me, it's interesting. That's usually the first sign for me. Like if I'm really at a point where it's like, okay, you need to check yourself, you need to catch a break. It usually is around less about fatigue for me and more around sleep. And it can be in two different directions. I'm either going to sleep a lot more, or I'll sleep. But for me, I get up through the night and I'm thinking, oh gosh, I got to do this tomorrow. I got to, where it's almost like I didn't unload everything. And so it affects how I sleep. So, I think paying attention to those sleep patterns and how they might differ. Again, for me, when that happens, it's usually I can say, okay, wait a second, I got to step back. Something's causing this. So that's, I think, a good physical sign to pay attention to. For people that I work with, the other piece I hear is just physical symptoms of things like, constant headaches or frequent headaches, tension in their muscles, those kind of stress related symptoms that we hear with anxiety, stomach aches, those types of things. So paying attention to that, if it's, kind of something that's occurring more frequently than people used to.
One other area, to maybe round out the physical pieces, I would just say like potential change in diets. And, certainly if, you're just like, oh, maybe I'm craving something a little bit more, or looking to indulge in something, like that doesn't mean that we're burnt out. But if it's becoming the pattern, if it's, every night is a cheat night and every night we're overindulging, or we see a reduction in appetite, it's I'm not hungry, I'm not eating lunch, I'm not doing, I'm not taking the time to really kind of re-nourish my body. Again, I think it doesn't have to only present in one way, but just noting changes there. And I think that's a fairly common one with the professionals that I work with, and seeing some of the effects that burnout can have.
Yeah, I think that's a really, important example. And, it's interesting. I'm thinking about a physician who I was working with who, when the burnout phase would start hitting for this individual, it wasn't that they were emotionally eating at night. What they would find is that they felt like they had to do so much during the day, they would forget to eat. And then it would be at night, it was almost like recovering their calories for the day.
Yeah.
But then that turned into then sleep problems because they were eating unusual patterns. But, we would always kind of work out like, okay, listen, if you skip lunch 2 days in a row, that's a sign that you're on that verge. Like that's an easy behavioral sign to go, I need to do this. When I don't, it impacts me. So yeah, I think watching our eating patterns and looking at, does that change over, a few days? At least it should be a red flag for us. Not that it indicates anything, but something to pay attention to.
And I think that's what all of these signs or like the symptoms that we're talking about of burnout, it's a flag, give some attention to it, and I may be jumping the gun here because it's something I'd like to really kind of apply to all of these areas. But when we find ourselves no longer being intentional, and certainly we can't be intentional with all things in our lives, but when we're just going through the motions more and more often, I think that's a flag. And, or noticing the various areas where something used to be, important, and noticing that. So I think that loss of intentionality, maybe not necessarily a specific area, but just in a very general sense is a really important, symptom there. Yeah,
I think that's a great point to make on that. And, kind of moving, I think, from physical, looking at more of those emotional signs, I think we oftentimes think people have to either be like, depressed or anxious. And I think that can happen for people, but I think emotionally before those things get to a high level, I think, we start seeing signs that I don't want to say are smaller signs, but maybe are more noticeable, and things like just, loss of enjoyment. So, so we're talking about work burnout. I told people, I love to come to work. I love my job. I love what I do. But when I notice that I'm having days where I'm like, oh man, just don't want to go in today. Again, does that mean I'm burnout? No, but it is something I could say, okay, that's something I need to pay attention to. And if that occurs over time, definitely could be a problem. And I think the other piece of that is, I use the word detachment, but I guess, disconnection that, emotionally, whether it's family or coworkers, we just maybe want to isolate more than we typically do, and not for healthy reasons, not because we need some me time, but more that we just can't tolerate more interaction from people.
And, in terms of an emotional piece, I think one that when we're talking about mental health professionals, it's a helping field. And so if we don't care anymore, like, that's an important thing to be mindful of. We're here because we care. And so if we stop caring, why are we still here? And so, that can then lead on to like many different thoughts. But I think that is certainly something to be intentional with, like when we're talking about that detached piece, where, if we're sitting down and a client sharing something, whether it's a success or whether it's, a tragedy, if we find ourselves really being maybe a bit more apathetic or, just, happy to hear that, like that flat, like we're not engaging in a way. And again, in a pervasive pattern, just those pieces to be aware and intentional of. And I think that can maybe contribute to a greater or to a larger loss of purpose. And I think that's a common one that I hear when I'm working with professionals that are experiencing burnout is, I don't know that I want to do this anymore. It doesn't really give to me in the same way. I don't really see value in my time, or I don't feel like I don't feel like I'm valuable, in what I'm doing here any longer. So I think that language or those thoughts being more present for us are certainly signs that, again, okay, let me be mindful and intentional with that.
Yeah, I use the word empathy, and I think the piece that I always kind of, again, looking at myself and just other people I've worked with is, do we start feeling annoyed by behaviors that people present with, or maybe even annoyed's a strong word, or even frustration. Like I've again, just kind of self-disclosure. I've had times where maybe I'm frustrated because somebody didn't do what we talked about doing, and I can feel that frustration. And that's a good sign for me. Like when I sit there and kind of go, okay, wait a second, like I'm reacting to something that is in their control, not my control. Maybe I need to step back for a second and kind of just take a pause and, kind of reset. So that's always a good thing for me, that if I do feel that, and I think it's important for clinicians to know it's okay to feel that way. Like we do have those frustrations in our field. But again, we're talking about pervasiveness, and these are just things to kind of go, okay, wait, why am I frustrated? Am I exhausted and, not feeling like I'm getting what I'm hoping that we're going to accomplish in certain sessions. So paying attention to that frustration, and, the CBT person in me has to say, then what thoughts are tied to it? It's not just I'm frustrated, but I always have to pause for a second and go, all right, what's going through my head that's making me react like that? Like, am I frustrated with them? Am I frustrated with myself? Am I like, what's happening? So again, I think through all of these signs, maybe the root of this, or the key is, how are we reflective, and how do we reflect daily to kind of go, okay, is this something that's problematic, or is it just a reaction? Like sometimes we're just frustrated, like that, and it means nothing more than that, but we want to be aware of it. So I always encourage people when we're doing, training and things, is, pause after your sessions for a second, pay attention to your own reactions. I guess that's maybe kind of a way how we manage this later on, but doing it in the moment and not waiting till it builds up, I think is always something that's usually helpful.
And I think this is maybe something that goes along with our emotional state, but maybe it's a thought, emotion, action kind of area, where finding ourselves either wishing away time in session. So, we're watching the clock, we're really not engaged, and, we're then just not being meaningful and intentional. Or on the other hand, really not maybe making the best clinical or sound judgment, and either overreacting or, not respecting boundaries. I would say, especially if we find ourselves over disclosing information that's not purposeful or significant, and is talking more about ourselves in the sessions. And I think that's a really valuable sign to kind of be aware of, that, hey, that really shouldn't be happening. Either, we have a whole episode on, personal disclosure. And I think the message we just kind of probably, hit time and time again is intentional. And if we kind of think about, again, that burnout is the loss of intention. And so when we find ourselves engaging in some of these things, it can potentially be harmful for our clients as well. And, I can't tell you the number of clients that I've talked with that have said like, hey, my old therapist just started talking about themselves, and, they just kind of made the session more about them. And I felt like I couldn't really relate, and I didn't know what to do. And so, certainly it has a ripple effect here, and just being mindful and aware of that.
Yeah, I think that, I think that just idea of boundaries as a whole is another, thing to pay attention to, and I think that goes, I think boundaries we can use in a couple ways. I think breaking boundaries and disclosures and things like that can be problematic. I think even boundaries in not saying no, just the idea that sometimes, again, I know we want to help people out and we want to make those arrangements, but sometimes if it's a crisis, that's a whole different scenario. We have to work through those situations. But if we don't have room in our schedules, it's okay to say, hey, if I have a cancellation, I'm going to get you in. I'm going to do my best, but we might have to wait 2 weeks. And knowing that for most people, that's going to be okay. And we're not doing harm by that. And again, difference in crisis situations, but sometimes we can overhelp. And the more we do that and we break those boundaries in that way, it starts trapping us. And I'm not doing therapy, but consulting with a therapist right now who, shared you're doing 58 hours a week. And I'm like, how did you get to 58 client hours a week? And, they were like, well, this person I really needed to see every week. And I'm like, based on what? Let's pause for a second. Is it if we spread it out every other week, it would be problematic? And then they said, well, yeah, I did it a couple times. And then the person really liked it. So we're continuing. And I said, well, pause for a second. It's great that you're doing that for your patient, but are you doing it at the cost of your own well-being? And then are you really there for your patient later? So there's that ripple effect. So yeah, I think that boundary piece is important because I think that then does impair sometimes the decisions we make. And again, we want to help, but we got to make sure that our helping doesn't also end up hurting in the long run. And how do we balance that?
And in some ways that over helping, I think can leave us then feeling frantic, we're like that. That we're stretched too thin and we try to then we what is that? We overpromise and underdeliver. Yeah. And the thought came to mind of, I'm a part of a couple different mental health groups on social media, or forums or threads, things like that. And just kind of like someone sends sets a post and then people comment and kind of share either experience or resources. And, I think more and more seeing people feeling like, hey, I don't know that I really want to do this, or I'm feeling ineffective, or I just, I'm just hitting this wall. And so, I think that even hearing and experiencing those and feeling like, oh, that's, almost like a global sense, feeling like the profession is almost kind of sputtering out at times. I think that can even almost contribute to a sense of burnout. It's like, oh, well, we are in this mental health crisis. So yeah, what else am I supposed to do? And yeah, the lack of boundary setting, that's what we would tell our clients. That's what we would, that's what the research says to do. And yet we're struggling as a profession to do what we preach here.
And I think there's so many variables I think that come into this. There's this kind of trying to create, and I'm going to use the word balance, although I never love that word. On one hand, we have clinicians who maybe work fee for service, and so they need client hours to get paid. And as we all in the field know, the reimbursement's not always great. And so to make a living to the level that we want, we have to see more client hours. And by seeing more client hours to have the finances available, we end up burning out. So there's this, trying to figure out how do we manage that is, it's not a new struggle. I remember before the whole mental health crisis, I remember, when I first got into professions, so 28 years ago, that being talked about and saying, listen, you have to see enough people to make enough money. But by making enough money, you got to watch that you don't burn out. And how do we create some balance with that? Or if we can't balance it, how do we put other things in our life to harmonize it? And sometimes we might not be able, we may have to see a lot of people to live the style of living. But then what do we do in addition to that to manage it so we don't get impacted? I think it's something we have to kind of kind of really try to figure out what works best for us. And I think as we go into maybe some ways to manage this down in a few minutes here, realizing that it's going to look different for everybody, and what works for me is not going to work for 10 other people. It really just depends on how do we create that harmony for ourselves.
Well, and as we've been talking about some of these signs, I think we've also been blending this idea of not only what does burnout look like, but why does it happen?
Yeah.
And I think we've touched on actually a lot of really valuable parts, but there's a bit more that I think that deserves some specific call outs. And one thing I think that is again a part of this profession is you said earlier, people don't come here to share how great of a day they've had. People are coming and sharing some really heavy things, and certainly there are certain areas of treatment focus, such as trauma, and others that have a heavy tone to them. But truly, all mental health takes a toll, and I think every mental health clinician hears and experiences a lot of hardship as they're sitting there with their client and working to process and support, and just being mindful of well, why am I experiencing burnout? We're getting the experiences of so many other individuals. And usually it's kind of the low light reel of, things and events that are going on in their lives. So, we're inundated with heavy, challenging things. And if we don't have positive supports in our lives, or like that harmony or that balance, then we can oftentimes find ourselves kind of following in some of the heavy stuff that's shared.
Yeah. It's interesting. I've thought about this a lot, in that, how do we manage the emotions that we deal with? And there's the whole idea of vicarious trauma and those types of things, but it doesn't have to be traumatic. I mean, it is just, you're right. It's heavy feelings, and to be a good therapist, we can't just let them bounce off of us. Like that in and of itself impacts what we do. So, I don't know if I have a good metaphor for this, but we have to be able to absorb some of those emotions at times. And, I think I do my best therapy when I let myself feel like I have to feel that a little bit, but not absorbing it to a point that it becomes overwhelming. And it's such a difficult kind of process of being able to let yourself be there with a person and go through some of those emotions, but not letting them kind of overwhelm us. Because at the end of the day, it's kind of like a sponge that would just be over full. Like, it would be too much. So how do we do that? I mean, what's your thoughts on how do you process those things?
So I think when I do my best at especially the hearing and sitting with the heavy things, it's when I'm able to have a clear idea of what my role is. And my role is to absorb, but my role is also to kind of reframe it. And actually, I just had a conversation today with a client. They're not in the mental health field, but they were doing well. We were starting to kind of, pull back, working towards maintenance. And I saw they picked up a cancellation slot on Excel, and we were meeting in person, which we've never met in person. So kind of cued me in on a change. And he comes in and he tells me about how his life just feels like it's completely changed in a moment. And he's not wrong. His life has drastically changed. And we were talking, doing some safety planning because there was some suicidal ideation pieces there. But we really ended session. And I was talking about, if there's one thing, in between now and next week when we're seeing each other again, is how do we try to inspire hope? In this situation, it feels like we're just stuck. And my role here was, I want to help you inspire hope, not feel like, it could be a hard road, but the road leads out of it. And, if we're able to follow it and like continuing on and inspiring that hope. So I think that's the piece that I carry on. And I think I can apply that just about every person of like, how do we inspire hope? How do we inspire positive changes? Going back to, some of the solution focused pieces with John Murphy, like what does better look like? All of those pieces that I think if we as clinicians can absorb, but also redirect in that way, I think that's a really strong way of challenging burnout. But when we find ourselves not able to do that, again, maybe another reason why we experience burnout is we don't know how to inspire hope, or maybe we don't have the capacity to inspire hope.
Yeah, I love that. And I think that reframe is absolutely how we can take in those emotions and also release them at the same time. Is that it is that reframe of saying, we have to look at the longer outcome and what's down the road. When you use the word hopeful, which I think is wonderful. It's how do we keep that in mind? So it's easier to take those emotions and be there with somebody if we can, at the end of the session, kind of go, okay, where are we going to go with this? And how do we kind of, in that way, release the emotion in a different direction? And again, we use the word intentional all the time, but I think that's important, and sometimes we're not in that hopeful phase with people right away. And I've had sessions where they're pretty heavy sessions and we might end to try to, start shifting that. But maybe we didn't get there. And those are times that I need to pause for a second. And at the end of the session go, okay, what am I going to do with this? What are we going to do? And what's the plan? And when I just take, and honestly, it's probably 30 seconds. I mean, it's not heavy processing, but if I have a session that's difficult and I use that as a motivation to go, okay, how am I going to use my skills to help this person kind of move in a different direction? And I just put myself on that path. It's just like almost like that weight of the emotions kind of leave. And so I'm glad you brought that point up. I think, whether we can do that in session all the time or not, if we can't, we at least need to do it for ourselves.
And, certainly this is such a personal experience. So the why, the why is, again, everyone ask yourself, why am I experiencing this? But one common area, and actually, Ray, you kind of brought it up as a double-edged sword, is, it's a why and how we can also make it better, but maybe talking about the first edge, which is technology, and just the difficulties that technology can create for us, because, as wonderful as it is, it's also a pathway to kind of skewed boundaries, or, is a wonderful entertainment outlet, but sometimes we're entertaining at the wrong times, which leads to procrastination and, and which then can lead to greater stress. And so all of those different pieces there, because, you were kind of sure, like, technology allows us to take work into home, or technology allows us for work to be home, with telehealth sessions and things like that. And, it's just this blending of boundaries. And, especially if you're on, you're in a session and maybe you ended on time, maybe it feels like, okay, yeah. And then, you pull out your phone to maybe do one intentional task. And then all of a sudden it's time for the next session and you didn't get anything done that you really should have done in that gap. And like, that's, I think, a different way that, like, why does this happen? And it's a loss of intentional boundaries, a loss of intentional time, time management, but it has us, just kind of going through the motions in a way that, really can then let some of this heavy stuff sit. And maybe we're not taking the 30 seconds after a session to really reframe it, reprocess it for ourselves. And then we're left, carrying that around with us. Yeah.
It becomes a distraction to our emotions. And I do think that's, in our field, something that I think can be dangerous, is that we can't just push them away. So I think technology, it definitely can do that. I think, you mentioned about the boundaries. I think that's probably the biggest one for me. I look at it and go, honestly, technology has made my life professionally so much easier. I love EHRs. There's so many things that are so much better because of it. But for me, it's been important that I have my own boundaries, and it may be, again, different for everyone. I've never done a telehealth session from my house. Even through COVID, I would get up in the morning, I would go into my office and I would do the sessions primarily for that boundary issue. Like for me, I want home to be home and I want work to be work. And I want to walk out of the door at the end of the day. And for some reason, that's a closure for me. And I don't know how I feel about the whole telehealth and work from home thing. Like I do get that it's great for some people, but I'll tell you, I see so many patients who, they work 20% more because they work at home than they would if they went to the office. And part of that's because there's more distractions at home. So they're not getting as much done during their typical work day. So now they're working in the evenings. I think in our profession, even if you come into the office, you can log on your computer and do your notes from home at night. But is that helping our burnout? Like, is that something that is, that's a good, healthy thing for us? Or is it something that it's creating more problems? And I think it's individual. For me, I need clear boundaries. And my boundaries are when I walk into the door of the office building in the morning, it's on. And when I walk out, it's off. And, with the exception of maybe an email popping up that I might look at, I don't tend to do like typical work tasks. And, for me, that's important. I think it depends on each person, but I think the technology piece, we at least have to pay attention to how we're using it.
And this might be I think it's a bit specific, but I think it's pervasive enough for a lot of mental health professionals that they're familiar with it. There's a lot of pressure, like so much pressure that comes, along with being in the mental health field. But the one in particular that comes to mind is the continuing education. And, making sure that we're filing for licensure and things like that. And, I try my best to get all of my hours in early and things like that. But sometimes it's, hey, I feel like I have to miss a day of work because, I'm attending a training or something like that. So, what am I going to be coming back into? Or, that dreaded like mad dash towards that, February cutoff line of like, do I have all my CEs? Do I have like my ethics hours, my job use hours? Like, and, is there programs like, like how, do I have webinars? Do I have the live hours? Like there can be a sense of pressure that because it's not necessarily a day-to-day thought, it can maybe, and if we're talking about individuals that are kind of losing that intentional experience, and all of a sudden we add on a significant stressor for them. And so, that one might be a bit specific, but I think it's a common experience for a lot of licensed individuals and, even individuals who aren't licensed, but just kind of attending trainings and, staying up to date. Like there's a pressure to that. Yeah, for sure.
And, it's interesting because that's one of those double-edged things as well. Like it creates stress because we have to get them done. But it also, I think, is one of the best ways we can relieve burnout.
Absolutely.
Like I think when we do trainings, it can invigorate us. Every conference I go to, like, I feel like I'm on fire when I come back. I'm like, oh, I want to try this. I want to do this. I learned this technique. And it's such a good thing. So it's almost like I would almost divide training in half. It's the planning to have to do it is a burnout potential.
Yeah.
But once we're there, if we put ourselves in that moment and let us ourselves absorb that information, I think it can really prevent things. And especially, again, just on a personal note, something I've always done is I force myself every year to do a training that has nothing to do with what I typically get trained in. Like it's something that's like, okay, I've never done a training in whatever, different kind of therapy or working with a different population. And part of that is because it creates something new for me. And I may never actually use it. Like, maybe I've gone to some where I'm like, I'm never going to do that. Like, that's not going to be my thing. But it was so nice to have something fresh and to learn something new. And so I think there's all different ways we can use it. But I think continuing it's like technology. it has both sides of the coin there.
And there's one like maybe not caveat, but I would say maybe small tweak to the way you broke it down into the two halves. And it's when we're not intentional, when we're at a training, and we're showing up because we have to be there because we need the credit. We're on our phone, or we're, responding to emails. So we're trying to do work while we're there at the training, not really being all that effective at either. And then, it feels like when we're done, we don't really know why we were there and to begin with. Don't really take anything away from it. And then we're back in, now feeling the pressure of a day that we didn't get to make progress on some of the mounting things. So I think that the difference between being intentional and absorbing information, it can, that can be the tool and the resilient, create resilience. But if we miss that, then it can very easily add to that consumed feeling.
That's a really good point. I didn't really think about that, but as you were talking, I was thinking, a few years ago, I started making a change on how I attend conferences or workshops, and what my change was I put my computer away. I don't take notes on my computer, which I did for a while. But what I found was I'd get distracted. I would, they would say something and I'd go, oh, I'm going to Google that. I want to see what that is. And then I missed the next 10 minutes, or an email would show up and I'd be like, oh, okay, I could just respond to that. So I was kind of in and out in trainings. And actually it was at a training, that the person said, listen, I want you, and it was a training actually on mindfulness. And the trainer said, I want you all to put your phones down, put them in your bag, put them on the floor, just get them off the table. And I want you to close all your laptops. I want you to take notes on pen and paper. Like the hotel gives you pen and paper that in the conference room. I want you to take your notes today. And the grumblings in the room was, were like, everybody's like, oh my gosh, like I haven't written, but it was kind of an interesting exercise. And about an hour in, I remember just going, wow, this is really different. Like I haven't done this in a long time. And I really enjoyed it. And so now, like, if I'm going to a conference and I really my goal was to come out of there knowing, something, I carry a notepad with me and I write things down, and I will tell you, it's a better experience for me. I mean, it sounds so simple. And honestly, like I would have never thought of it, but doing it, I was like, okay, this makes a difference. And I find, now the downfall to it is then I have to go and try to figure out what I wrote and type out my notes. It creates stress down the line. But, now we know there's technology now that we can write and it types it out for us. So yeah, I'm actually, my next conference, I'm actually going to try to take my notes on my iPad. So I'm going to see if that works as well, because I don't have my email and things on there. So that might be another way, but I have found writing out notes have actually been better. So.
And well, we're talking about kind of this balancing act or maybe a harmonizing act. I guess that doesn't roll off the tongue as well. Where certain things can be the why, but it can also be the how. We kind of work to challenge or work to really develop resilience against burnout. And so, I love that idea of being intentional and really trying to kind of stop and absorbing the good stuff as much as we can absorb the bad stuff in sessions. And, also talking about technology. And I guess the other side of that sword being just how it can really optimize, and it gives us a greater reach. It allows for organization. It allows for, you mentioned earlier, we don't have to keep case files on who we saw throughout the week. Our EMR creates a list of individuals that, and we can go back, and if it was a telehealth session, we can see exactly when the start time was, when it ended. We can then easily jump on and see when the next sessions are. So as much as technology can be a distraction, it's also a wonderful tool. And so again, if we're able to try to challenge that and maybe kind of initial eye roll kind of experience that I think can come, especially when we're in that burnout phase, and trying to say, how do I be intentional with my use of this to help to optimize and to help to pull me out of that experience of being unintentional?
Yeah. And, I think as we're kind of talking about that, maybe let's kind of wrap up with talking about a few other kind of strategies. And, for me, I think of these things like, in what do we do individually? And then maybe what are more kind of organizational things and things we might have to work with our job around with our job. But, I just a few things that pop into my mind individually is, and I think we're kind of just summarizing what we've said is self-awareness and reflection being number one. Like, take a moment. One of the reasons I like coming into the office is I have a car ride home, and that is a great reflection time for me. And I sit down and I kind of unpack in my own head what's happened through the day. So when I walk through my door at my house, and I can be into that mode. So I think self-awareness is a big one that I would put as a good individual one.
And along with that, I think expanding our role. So, I love being, a therapist, but I'm not only a therapist. And, coming back to using the term, the mental health crisis, I think it's easy to be in therapist mode, outside of the office, for it to be like that boundary setting piece. And so making sure that we're engaging in our other roles, how am I as, personally, how am I as a husband? How am I as a stepfather? How am I, as a son? How am I as a friend? And, giving time and space to those different roles, and especially time for ourselves. What are our hobbies? What are the things that really kind of maybe give us a sense of just like, I can really take that deep breath and I don't have to then carry all of this around, or it gets us animated and excited, things that we're really kind of passionate about. And so how do we explore those areas outside of the mental health field, just as much as we can, and attending conferences and trainings and the things that get us excited and intentional when we are, wearing that hat.
Yeah, the self-care things are just so valuable. And, you mentioned things like hobbies, and I think just even the permission to have downtime. And I think not everything has to have a purpose. there's, I've had weeks that have been difficult, and I kind of go, okay, like this weekend, I'm just going to watch a show that's I don't have to even think about. And, and it might be, old Office reruns that come on, or Seinfeld, or it could be something that simple that I've seen 100 times. But it lets me just kind of turn it off for a little bit. Or maybe it is downtime where I do watch something new, which is great as well. But it could be anything, I think, again, we have to find what are the things that for us are exciting. One of the things I love is cooking. And, so it's like, if I'm really stressed for a week, I might on Sunday go, hey, I'm going to make something I've never made before. Now, there's times that's as frustrating as the week, but I guess challenging ourselves in another realm is I guess what I'm getting at. So I think, that's good. The other thing I'd kind of add to the individual pieces, I think the value of seeking out, whether we call it supervision or consultation, with a peer, I think is incredibly valuable. And that doesn't mean supervision or consultation about specific clients. I've had great supervisors in my career and have been truly blessed for that. But they all had one thing in common. Part of my supervision was about me. It was about, going, yeah, this is a tough case. How are you handling that? Like, how's that been for you to, go through these things? And so I find myself even today, different kind of supervision for me at this point in my career. But, how many times I might just call a friend and just say, hey, like I'm stressing out right now. I need a sounding board. I just need somebody to, talk to. And, and my friends I find are actually who are also professionals in the field are great, because sometimes I'm like, all right, like, check yourself for a second, and they'll call me out, which I think is really good. But I think seeking that supervision and having somebody that you can just walk into their office and just be like, hey, I just need a minute. It's invaluable.
And the permission to even take that a step further and go see a professional, and sometimes it can feel like, again, that stigma of a professional seeing a professional. But, again, if we feel like, either we're not worthy or we're not allowed to, then, why are our clients coming and seeing us? So giving ourselves that permission when valuable and necessary to kind of go and seek that, because, as much as I would love, with my thoughts and my understanding, in the field, to then apply that to myself, there's so much bias that just stops it from being nearly as effective. And, hearing it, even if it's similar things that others are saying, or even similar things I'm saying to myself, hearing it from a different lens, or a different, arranged in a different way or a different voice, can sometimes make a difference. And so, certainly challenging that stigma of mental health professionals not seeing mental health professionals.
Yeah, it's interesting. Like, I'm kind of dating myself. My training was a long time ago, but one of the values I think in my training was that we were encouraged before we started doing therapy to go to therapy, and just for some self-reflection. And it was short term initially, but I'll tell you, it was such a value, because it made it broke it down for me that it was okay to go. Two, I learned a lot, about myself and just about the process in general. And I think we need to do more of that. I think you're right. I think, being able to sit down and somebody who we don't know, who's not a colleague, and, you used the word bias, which I think, yeah, absolutely. Like listen, I think I have a lot of skills to help other people, but it is different when it's yourself. I oftentimes say, I talk to parents all the time about how to help their kids, but I have my own kids and I can't think like that. It's like when when you're in that situation differently, it changes your perspective. So yeah, I agree. I think, trying to seek somebody out, even if it's not a regular basis, but as an as needed basis, can be really valuable. I think it's sometimes we can't see beyond our own skill level, like we can't see in ourselves. And it's interesting. I've talked to people, like I said, early in my career, as part of my training, and it was always amazing when a therapist would say something, I'd go, that's kind of interesting. Like I knew that, but I couldn't see it in myself. So it's a great suggestion.
Whether it's, professional growth through attending conferences or trainings, the structured clinical supervisions, or if it's finding things in our personal lives through self-care, self-awareness, reaching out to friends, being in, forming connections with family, having downtime. I think that really something that's kind of distilled down that I'm hearing is that it's in being intentional, and burnouts maybe when we start to lose intention. And so if we can reignite that sense of intention for ourselves, maybe we can burn away the burnout.
I agree. I think that's maybe a good line to wrap up on is that. And, again, I'm glad we kind of took time to call this out, and, maybe in the future, it should be a further discussion. I think just a really important topic. So,
well, we hope you enjoyed this week's episode. Please tune in next week. But until then, be well, stay psyched. The information contained in this podcast and on the Psyched to Practice website is intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional, psychological, psychiatric, educational, or medical advice, diagnosis, or treatment. Please note that no professional-patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host, guests, and listeners of this podcast. If you need the qualified advice of a mental health professional or practitioner, please contact services in your area, Similarly, if you need supervision on clinical matters, please locate a supervisor with experience to fit your professional needs.